In clinical and research environments, communication must be both rapid and precise. Medical abbreviations and acronyms serve as a standardized shorthand, enabling healthcare professionals to convey complex information efficiently and consistently in patient charts, lab reports, prescriptions, and academic literature. This module provides a structured overview of common medical abbreviations. Misinterpretation of these terms can have significant consequences for patient safety and treatment outcomes. The objective of this training is to facilitate the accurate interpretation of clinical documentation and to build a foundational vocabulary for effective communication within the healthcare field, organized by functional category for better retention and understanding. The first functional category covers diagnostics and laboratory testing. These terms provide critical data about a patient's physiological state. A key example is CBC, standing for Complete Blood Count, which assesses overall blood health. This single abbreviation allows a provider to quickly understand a patient's red and white blood cell levels. Continuing with diagnostics, we use BUN for blood urea nitrogen and GFR for glomerular filtration rate to evaluate kidney function. For liver function, enzymes are monitored via AST and ALT. These abbreviations allow for the rapid reporting of complex biochemical assays that are essential for determining a patient's internal organ health. Imaging techniques are also frequently abbreviated in clinical settings. CT stands for computed tomography, while MRI refers to magnetic resonance imaging. These tools are vital for visualizing internal structures, and using their shorthand allows for faster scheduling, reporting, and consultation between radiologists and the primary care or surgical teams. The second category involves clinical measurements and vital signs. These are fundamental metrics for ongoing patient assessment. BP stands for blood pressure, one of the most frequently recorded data points in any clinical encounter. Understanding these metrics is essential for monitoring patient stability and identifying early signs of physiological distress. Respiratory function is monitored using specific abbreviations, like SaO2, which indicates arterial oxygen saturation, and PCO2, representing the partial pressure of carbon dioxide. These abbreviations are key indicators of how well a patient is breathing and exchanging gases, providing immediate insights into their respiratory status during critical care. Dosing, frequency, and administration is a critical category for pharmacology. Terms like BID, meaning twice a day, and TID, meaning 3 times a day, dictate dosing frequency. We also use PRN, which translates to as needed. These Latin-derived abbreviations ensure that medication schedules are followed precisely across different shifts. Routes of administration are specified by PO for oral delivery, IM for intramuscular injections, and IV for intravenous access. Correctly identifying the route is paramount to patient safety, as the same medication may have different concentrations or effects depending on whether it is swallowed, injected into muscle, or delivered intravenously. A particularly crucial directive is NPO, or nothing by mouth. This instruction is essential prior to surgical procedures or specific diagnostic tests to prevent complications like aspiration. Clear communication of NPO status is a high-priority safety measure that requires every member of the healthcare team to be fully aware. Abbreviations are also used to denote specific diseases and conditions. COPD refers to chronic obstructive pulmonary disease, MI stands for myocardial infarction or heart attack, and UTI represents a urinary tract infection. Using these terms allows for concise documentation in patient histories, enabling other providers to quickly grasp primary diagnoses. Anatomical systems are similarly abbreviated for efficiency. CNS stands for the central nervous system, while GI refers to the gastrointestinal system. By using these standardized terms, healthcare professionals can quickly categorize symptoms, treatments, and specialist referrals, ensuring that the focus remains on the specific physiological system requiring medical attention. Precision with units of measurement is paramount to patient safety in both diagnostics and treatment. Standard abbreviations include mg for milligram, ml for milliliter, and kilogram for kilogram. These units form the foundational language of dosage calculation and laboratory reporting, where even a small error in interpretation can lead to mistakes. In summary, medical abbreviations are an integral component of the language of healthcare, systematically categorized by function to cover diagnostics, clinical measurements, treatment protocols, and disease classification. Proficiency with these terms is essential for the accurate interpretation of patient data, ensuring that every piece of information is understood exactly as intended. The key takeaway is that correctly using and understanding this standardized shorthand is not merely a matter of convenience. It directly contributes to patient safety, treatment efficacy, and overall clinical efficiency. A thorough understanding of this vocabulary is a core competency for all healthcare professionals, facilitating clear interprofessional communication and better patient outcomes.